Good afternoon. I'm delighted to welcome you all to the 2021 annual meeting of the MEP Interest Group on Antimicrobial Resistance, or AMR. The MEP Interest Group on AMR is a strong network of 18 MEPs from across the political spectrum who are working together to make Europe a global leader in the fight against the global health threat. I'm Sarvino and the president from this group. Our group was launched at the European Parliament over 1 year ago when circumstances still allowed for a physical meeting. Let's hope that the pandemic response will make an in-person meeting possible next year. The COVID-19 crisis has demonstrated how pandemics can transform our lives and impact our societies. AMR is also a pandemic, a silent one, but still a pandemic, and the cost of inaction will be huge. Antimicrobials are the backbone of modern medicine. Without them, a common infection that we can currently treat will once again become fatal, and procedures such as cancer, chemotherapy, diabetes management, major surgery, or organ transplantation would put patients at much higher risk. There are many drivers for AMR. The overuse of antimicrobials in agriculture and aquaculture, alongside human medicine, is an important one among them. When antimicrobials are used in aquaculture, livestock and crop production, resistant microorganisms can develop, spread to the environment and contaminate the food chain. Thanks to improved good practice in biosecurity, prevention and surveillance, there has been growing progress in the EU in promoting the responsible use of antimicrobials in food production. In addition, the farm-to-fork strategy sets a target to decrease antimicrobial sales for farmed animals and in aquaculture by 50% by 2030. The regulations on veterinary medicinal products and medicated feed, which will come into force next January, will be key instrument to reach these targets. While there is progress, there also remain concerns whether member states and the food production sector are ready to implement and comply with new provisions, and whether there is sufficient awareness of the deeper system changes need to move towards a more sustainable model of food production. This year will be key to make sure the EU sets a bar high as 7 delegated and implementing acts that directly impact the fight against AMR need to be adopted in relation to these regulations, including a key list of medically important antimicrobials that will be reserved for human use. So I'm glad we are bringing together today representatives from the Portuguese Council Presidency, the European Commission, the food production sector, civil society, and academia to discuss opportunities for these transitions to a sustainable model of food production that ensures responsible antimicrobial use and contributes to the global response to tackling AMR. Before we move to our first session, I would like to warmly welcome and give the floor to Susana Bompo, Chief Veterinary Officer and Director General of the Portuguese Directorate General of Food and Veterinary Medicine, who will say a few words on behalf of the Council Presidency. Please, Susana, the floor is yours.
Thank you. Thank you. Dear members, ladies and gentlemen, it's my pleasure on behalf of the Portuguese Presidency to welcome you to the annual meeting of the members of the European Parliament Interest Group on Antimicrobial Resistance. Antimicrobial resistance is a major public health threat at global level and has driven the European Union's attention for the last years and will and must continue to demand action from the governments. The health, agriculture, and the environmental sectors are very aware of the need to take multi-sectoral actions, has very well engaged with the One Health approach, and are taking measures under the EU's 2017 One Health Action Plan. Besides the implementation of the actions foreseen under the EU Action Plan, there are several other actions that are being taken by member states at the EU and international levels. The revised EU legislation regarding veterinary medicines and medicated feed, which was negotiated between the European Parliament and the Council and adopted in 2018, is a significant step towards further enforcing the prudent use of antimicrobials in animals. It requires that antimicrobials are not used to promote growth and to increase yield. It regulates the use of antimicrobials for prophylaxis and metaphylaxis and prohibits the use of antimicrobials reserved for treatment of certain infections in humans in order to preserve the effectiveness of those antimicrobials. This legislation is built on the One Health Action Plan against antimicrobial resistance. In this regard, the decrease in antimicrobial sales in livestock farming since 2011 is acknowledged. This is also reflected in the Commission Farm to Fork strategy, in which the Commission has set the ambitious target of reducing by 50% overall EU sales of antimicrobials used for farmed animals and in aquaculture by 2030. Moreover, the medically justified use of antimicrobials contributes to animal welfare by ensuring healthy animals, as well as providing safe and nutritious food, thus complementing the One Health approach. During the Portuguese Presidency, we have worked to approve an amendment of the Official Control Regulation as regards official controls on animals and products of animal origin exported from third countries to the Union to ensure compliance with the prohibition of certain uses of antimicrobials. However, this work is not yet finished, but will be followed by the Slovenian presidency. During our presidency, we have also worked on the preparation of the next session of Codex Alimentarius Task Force on Antimicrobial Resistance, which is negotiating on 2 documents which aim for a global stepwise approach to fighting AMR, namely the Guidelines on Integrated Monitoring and Surveillance of Foodborne Antimicrobial Resistance and the Code of Practice to Minimize and Contain Antimicrobial Resistance. These documents are very important, as they will help countries worldwide to collect essential data and to build up national policies and national measures to face AMR. This is a challenging task, and it would be very important to have support from our international partners in completing the work in a sufficiently ambitious level. This fight is a significant mission and a great responsibility to all of us in different fields of action. I'm not talking only about human, animal, and environmental health sectors, but I'm also talking about raising awareness through universities, technical institutions, industry, politicians, and regular citizens. In fact, antimicrobial resistance will remain in our agendas in the upcoming years, and it will be critically important to our society. We are all in the same planet, and as you know, bacteria do not recognize country borders. This fight concerns everyone, and it is a global responsibility to ensure that future generations can benefit from effective antimicrobial treatments. The role of the members of the European Parliament is essential, and we welcome the work of this working group. We know that 2020's pandemic was in fact a wake-up call for a new global reality that we are facing. Let us therefore join again our efforts in the fight against antimicrobial resistance, where we must be able to shape the global agenda, ensuring preparedness globally for this emerging issue and enabling the response to social and economic challenges. Together we will make a difference. Let's all spread the message regarding antimicrobials. The more we use them, the more we lose them. Thank you for your attention, and I wish you a very successful meeting.
Thank you very much, Susanna, for these insightful remarks. It has been a pleasure to working with Portugal in the last 6 months as you helped keep AMR high on the political agenda during your presidency of the Council, notably during the Global Health Conference. I am now delighted to kick off the first session of today's meeting that will discuss the barriers to a more sustainable food production system that minimize antimicrobial use. For this, I give the floor to Jean-Yves from Healthcare Without Harm Europe, who will moderate this session. Jean-Yves, the floor is yours.
Thank you very much, Sarah, and good afternoon, everyone. It's a real pleasure for me to moderate this session on behalf of the MEP Interest Group Secretariat that Healthcare Without Harm Europe is co-hosting with the European Public Health Alliance and the support of the AMR Stakeholder Network, a network of more than 60 leading organizations and individuals committed to tackling AMR at national, regional, and European levels, covering all dimensions of the One Health approach. We have an excellent panel today and limited time, so I would suggest directly turning to our 5 speakers, whom I invite to turn on their cameras. They will give short introductory remarks, followed by an interactive discussion, during which we will take questions from the audience. We obviously want this session to be as interactive as possible, so please use the Q&A function at the bottom of your screen to comment and ask questions. We will get back to them in the second part of this session. You will also have the opportunity to engage on Twitter with the hashtag of the MEP Interest Group, hashtag MEPVSAMR. Please note that the webinar is being recorded and that the recording will be sent to you by email and published on the webpage of the MEP Interest Group in the next few days. Our first panelist is Eva Zamora Escribano, who is Head of Unit for Animal Nutrition and Veterinary Medicines at the European Commission. Eva, how will the EU regulations on veterinary medicinal products and medicated feeds contribute to the targets included in the Farm to Fork strategy? I think you have prepared a presentation for us. The floor is yours.
Thank you very much, dear members, ladies and gentlemen. Good afternoon to everyone. First of all, many thanks for inviting me to this important meeting. For me, it's a real pleasure now that we are very close to the implementation of the new regulation on veterinary medicines. I'm not sure if you can see the presentation on the screen. Now it is okay. Sorry, apologies. This is the problem of the technology, but I'm going to be very, very brief because I think that I just want to give you a short overview about the future legislation on veterinary medicines and medicated feed. My focus today will be on the VMP regulation, and this is a major step forward for the Union to fight antimicrobial resistance, and I think that we should all be very proud of it. So as mentioned by previous speakers, we are leaders at the global level in fighting antimicrobial resistance, and the measures that will be in place very soon in January next year will have, in our view, a major contribution to this. So on the screen, you can see a number of measures that are already included in the legislation. For some of them, we will need, and we are developing a number of legal acts. But what I think is important to highlight today is that we cannot see the measures in isolation, and we need to see each other as a full package and in the right context. So here you have the list of legal acts for which the Commission has been empowered to develop legal acts. So before the regulation is applicable in January 2024, you can see on the screen identified 4 important legal acts to which I will explain you a bit later. And then in the next slide, you will see that we will not stop working once the regulation is applicable in January, but we have still some empowerments to work on another 3 legal acts. So we have a total of 8 empowerments in which the Commission is working, or it will be working as a priority. Here you have in this slide those empowerments or those legal acts what we are working on in relation to monitoring and risk management. So far, I think that we have had a very good progress, because the delegated act on the requirements for the collection of data on sales and use of antimicrobial resistance has already been published, and we are working together with the member states in the second act, which will bring the format for the collection of data and sales and use of antimicrobials. Why is this so important? This is so important because having the right data will help us in the future to see which kind of target measures we can put in place. So this is a very important piece of legislation which will be very helpful in the fight against antimicrobial resistance. When moving to the next slide, here you can see a series of legal acts which are more related to prudent use of antimicrobials, which is one of the main objectives of our regulation. And here you have three important pieces of the legislation. I want to take the opportunity to refer to the opinions that we are getting for the European Medicines Agency when drafting every piece of the legislation. And in this respect, it has already been mentioned during the introductory remarks, the Commission has adopted a delegated act on the criteria to designate antimicrobials reserved for human use only. And this is, I think, for the first time that there will be legal acts in place in order to ban this at the level of of the world, because I think that we will be the first one in having this important restriction. So once the Commission is finalizing this act, which is currently under the objection period in the European Parliament, we will be drafting the list of antimicrobials reserved for human use, which will not only be applicable in the Union, but will also be applicable for imports of animals and products of animal origin into the Union, which is also a major step forward. So here you have the progress that we have achieved so far. Of course, there are many other provisions in the legislation which were already mentioned by previous speakers. And as you can see here, there is a very close link to the Farm to Fork strategy. We find that the implementation of the new legislation will have an important contribution to achieve this important target. And of course, and as already followed at the Union level, this is fully in line with the One Health approach. So I hope that my presentation was not very long. You can follow the process in the link that you can see on the screen. And with this, I would like to thank you all for your attention. And I will be pleased to reply to any questions. Thank you.
Thank you very much for this detailed overview, Eva. I think this certainly gives a good framework for upcoming discussion. I'd like to remind participants that they can use the Q&A function to ask questions or put comments for Eva. I'm now turning to our next speaker with Peter Stevenson. He's Chief Policy Advisor at Compassion in World Farming. Peter, you have worked in the animal welfare movement for almost 3 decades. So it would be great to hear from you whether you think these new regulations will improve the sustainability of the EU food production system. The floor is yours.
I fear that many member states and the EU livestock sector are not ready to comply with the ban on the routine use of antimicrobials that comes into force in January. The ban is strongly worded. It prohibits the prophylactic use of antimicrobials in groups of animals. Prophylaxis will only be permitted in individual animals in exceptional circumstances. So the practice of routinely adding antimicrobials to the feed and water of whole groups of animals to prevent disease will be unlawful. I'm pleased that the Commission aims to reduce the sale of farm antimicrobials by 50% by 2030. But I wonder if is even this going to be enough? I say this because the European Medicines Agency has said that 87% of farm antimicrobial sales in the EU are suitable for use in groups of animals, i.e. for prophylaxis or metaphylaxis. But prophylaxis in groups and routine metaphylaxis will be illegal from January. So we may need to aim even higher than 50%. Either way, whether it's 50% or rather more, if we're to comply with the regulation, we need in Europe to move to what I'd like to call health-oriented systems for rearing animals, systems in which good health is inherent in the farming methods, rather than being propped up by routine use of antimicrobials. So what would these health-oriented systems look like? Well, they would avoid overcrowding and very high groups, high flocks and herds, because these contribute to the emergence, spread, and amplification of pathogens. They would minimize stress, as stress undermines animals' immune systems, making them vulnerable to disease. They would ensure that animals can engage in their natural behaviors, as inability to do so is stressful. There would be an end to the early weaning of pigs, because this is the main factor leading to the very high use of antimicrobials in the pig sector. These health-oriented systems would ensure good air quality, such as low levels of ammonia, dust, and carbon dioxide, because poor air quality can lead to respiratory disease. And they would avoid the use of animals genetically selected for very fast growth rates and high yields, as these animals are vulnerable to immunological and physiological disorders. In short, if we're to respect the new regulation, we need to have a far-reaching rethink about how we farm animals. Thank you.
And thank you very much to you, Peter. I think you made a lot of very interesting points here, and I'm sure we'll get back to them during the Q&A section of this session. Before that, I'd like to give the floor to MEP Papatikainen, a member of our MEP Interest Group on AMR and a vocal supporter for animal welfare. So what's your take into this, Sirpa?
Sorry, this is allergy. I'm happy to be part of this debate, and I'm very happy to notice what is the progress by the Commission so far, and very supportive for the next steps. Unfortunately, I'm slightly pessimistic in the way Peter Stevenson is skeptical, and I do not have anything to add on his list what it means besides free ranging to raise the cattle and production animals so that they are healthy, so that we do not need prophylactic use of antibiotics, and that we actually boost the immune systems. And we all know that you can use diets and, for example, lactobacillus bacteria to support the immune systems. So we know all that. But why am I here discussing these topics? I don't know, is it my 10th or 15th time during my 13 years in the European Parliament? And why is the progress so slow? This is what I'm astonished and upset. And this is what I'm astonished and upset, what is still the resistance from the agricultural side. And actually, I would have one worry on the 3 proposals, even though I know they wouldn't be progressing so far. I would take the position that none of the common agricultural policy money would go to that kind of farms that do not obey this animal welfare regulation and the AMR regulations. So medicine to animals only to treat a disease, or in very restricted cases, a prophylactic treatment, let's say in the younghood of a single animal. And that would ensure that also the implementation of the plans are proper in place and not just words and on the basis of member states and member states looking after that the regulation is followed. Then the next topic what I would like to raise there is, of course, and this is very good from the Commission, and we have had quite a fight about it in the Parliament, that we have the means to intervene with the imports of the animal that have been treated with high amounts or in prophylactic treatment of antibiotics. Because we all know that the last line antibiotics are in some cases used already in regular feeding system in China. So this is something that I think that we should intervene, and this is something, be it possible or not, I would include in our trade agreements, and I would start negotiating an international convention of AMR and the use of antibiotics in animal feedstock and animal treatment, and to push that to be in FAO UN framework. And then the second point, and that links to the substance, even though it doesn't link so closely to animals, is the fact that the majority of effective ingredients are manufactured in the large scale in 2 factories, one in China and one in India globally. And according to a statistic, you have a medically effective levels of antibiotics and other medicines on those rivers and waters close by. And you can imagine what impact that has when the antibiotics and other medicines are distributed freely in large scales in the waters and air, and I suspect on the ground also. This is one thing and one linkage that I think that we would need to make with coming back because of the security reasons, the pharmaceutical strategy, also to ensure that adequate numbers of needed pharmaceuticals are produced in a safe way in Europe and not imported from irresponsible sources that are going to kick us on AMR, but I suspect in other fields too. Thank you very much. I'm happy to be part of the discussion.
Thank you very much, Ipara. And you made a really good point here about trade agreements, which makes a good link with the next session we'll have afterwards, which is actually discuss the role the EU could play in influencing global decision in the framework of antimicrobial resistance. So I'd like to remind participants that you can ask your questions or make comments in the Q&A function at the bottom of your screen. And I'm now glad to turn to Jeroen Wolf, who is professor in veterinary epidemiology at Ghent University and author of the book 8 Myths on AMR Disproved, Practical Guide for Reducing Antibiotic Use in Animal Husbandry. So Jeroen, what do these new regulations mean for the veterinary sector? The floor is yours.
Thank you very much, and thank you for the invitation to be here and to present to you. And I think, well, I can tell that I would, as a scientist working in this field for many years already, I welcome very much the ambitions of the Commission, and I think indeed the new legislation is quite ambitious. And as has been said before, for some countries it's going to be a big deal or a big goal to achieve these goals. But I think they are realistic. So they're ambitious, but they are realistic. And my evaluation is based on the fact that already many countries also in Europe, and especially many farmers in Europe in different countries, have already today proven that it's possible to raise animals with much lesser antimicrobials than we've done in the past, or we are currently still doing in some production systems. So I would very much believe that that's also where our research is going to, and a lot of research from many different scientific groups is going to, is to look into sustainable animal production. And it was called health-orientated production before, and I think it's a very nice terminology indeed, is that we have to strive towards animal production where animals are kept healthy, and if we keep them healthy, we do not need the antibiotics. And I'm also very much convinced that that does not need to result into a lesser sustainable production in terms also for productivity for the farmers, because we should not forget that there's a lot of people that breed animals for a living. So also for them, we have to make sure that we find solutions that are achievable, that are possible. So we have to help farmers towards this health-orientated production systems. I'm not 100% convinced in the fact that we know everything, and I'm certainly not convinced in the idea that it's an easy task. It's not, and we should not present it as being easy. I think we have to present it as being a challenge, and we have to help them. There's a lot of research still to be done in terms of improvements of biosecurity, in terms of getting better vaccines, in terms of improving the production systems. And indeed, as somewhere mentioned, the early weaning, which is a terrible mistake we've made in the past, we have to get rid of. But there's other improvements that still we are still looking for. We are studying on to find out how we can combine a good productivity with a better welfare, with a better health. Because at the end of the story, we should not forget that if we outcompete our own European farmers, if we make it so difficult for them to produce, that we will import all the food from other parts of the world where it's not necessarily done better. So I'm very much also in favor of the idea that we have high demands for our production, for our farmers, but at the same time, we also provide them with an honest price for their products. And I think we have to include that into the discussion as well, because I mean, if we do not do that, the risk is that we're going to import it from somewhere else, and that's not in the benefit of the humans, neither it is in the benefit of the animals themselves. I would also want to emphasize on the importance of the monitoring of the usage. I think if you cannot measure it, you cannot improve it. It has been said before many times, and it's increasing. It's terrible important, and we've seen it in those countries that have already gone through important improvements, is that they've used these monitoring systems, and the fact that they are now obligatory into the European legislation is going to mean a great deal, because it's through measuring that you can make things very obvious, and by making them obvious, you can also promote, or you can motivate people to improve this. So I'm very hopeful on that side. And again, I've shown, or we have shown in our research, and others have shown it, that it is possible to do it with much less antibiotics, and at the same time keeping up your productivity. The idea of big farms are bad farms, I'm not so much standing behind that idea. It's not because you're big that you're bad. You can have good farms that are quite large and run with a very good management and a very good animal health, and you can have very small farms that have been run very terribly. So the size of the farm is not necessarily the thing that is, but it's the management, it's the stocking density, it's the air quality, and so many other things that have to be optimal to achieve a good animal production. But once more, it is possible.
Thank you very much, Jeroen. I'm jumping directly to our next speaker because we have limited time and there is a lot of grounds to cover here, obviously. We heard from the veterinary sector. Now let's turn to the health sector, the healthcare sector, which is probably the one which is the most impacted by the rise of drug-resistant microorganisms. So I'm glad to welcome Imke Lührs, who is a board member of Doctors Against Factory Farming, who is going to talk about what the new regulations mean for Germany. And Imke, I think you have prepared a presentation you wanted to share with us. The floor is yours.
Thank you, Jean-Yves. Yes, thank you for introducing me. I'm a doctor of internal medicine and rheumatology from Bremen, Germany, and working for the organization Doctors Against Industrial Farming. We have more than 800 supporters in the medical field. And I want to tell you about the situation in Germany, mainly concerning the use of critically important antimicrobials of highest priority, or shortly CIAHP, or to make it even shorter, reserve antibiotics as defined by the WHO in 2019. Since 2011, when monitoring had been established, Germany has experienced a drop in the total consumption of antibiotics in farming by more than 60%. This drop is calculated in tons of the different substances, which may lead to misunderstanding because the proportion of reserve antibiotics seems lower than it is. But even some of these drugs show a decrease until 2017, whereas since then, the absolute amount is constant. One can draw the conclusion that this is due to the unchanged bad conditions of animal husbandry. Since 2018, when antibiograms became compulsory for the use of cephalosporins of third and fourth generation and fluoroquinolones, a significant drop can be seen in these drugs. But there's no drop in poultry production, where the proportion of reserve antibiotics is still 40%, whereas it is only 10% in pigs and cattle. So, Since last week, we have a new Medicines Act for veterinary use. It had to be changed according to the EU regulation 2019-6. There's no change in monitoring. We criticize that that daily defined doses are not monitored and that there are no target figures laid down. But above all, there's no detailed regulation for antimicrobials, which should be reserved for human use. But this can later be done by ordinance. German Parliament refused to lay down a list to be reserved for human use. Probably they are waiting for EU regulation. What is our position? The use of CIAHP after the WHO list 2019 should be banned in industrial animal production. This can only work through improving animal health and animal welfare, better system design, and the selection of breeds that are less susceptible to disease. This, our position, is supported by the German Medical Association and several environmental organizations in Germany. And a recently completed legal analysis by Dr. Davina Brun comes to these conclusions. The ban of CIAHP in Germany is according to EU law and German constitution and required by German constitution to ensure the functioning of our health and social system. Thank you.
Thank you very much, Imke. And it's great to hear a perspective from Germany on this. And before turning to the Q&A part of this session, I'd like to come back to this delegated act, setting up criteria for identifying antimicrobials to be reserved for human use that Eva mentioned in the presentation, because this delegated act was adopted by the Commission in late May, but there are currently discussions within the Parliament to potentially object to it, and a debate was held in the ENVI committee yesterday. And I think that MEP Sarvino wanted to say a few words about this. So Sarah, I'm giving the floor back to you for your comments.
Thank you so much, Jean-Yves. As you all know, the regulation of veterinary medicines has given the Commission a mandate to establish criteria for the designation of criteria for human reserve antimicrobials by end of September 2021. The draft criteria have been published end of May and have been notified to Council and Parliament for their scrutiny. My Green colleague Martin Häusling, who can unfortunately not be here today, has notified an objection to the criteria 2 weeks ago because he's afraid, and not just he, that the criteria are far too restrictive. The issue was debated yesterday in the MEP committee. The other groups did not yet take a position, but also raised some doubts about the COM criteria, so this is a hot topic. What are the concerns? The Commission sets out 3 different criteria, all of which have to be met for an antimicrobial to be reserved for human use. The first criterion is about high importance to human health. No disagreement to that. The second criterion is about risk of transmission of resistance. The Commission requires evidence of significant transmission and thus deviates from the criteria of the WHO, which only require proof that potential for such transmission exists. Martin and others argue that we should follow the WHO and not require quantification, as this is always difficult. And then the third criterion is about non-essential use for animal health. That is a contradiction in terms. The reason to reserve certain antimicrobials for human use only is that it is essential to preserve their efficacy for humans, to be able to have a last resort against serious life-threatening infections. In this view, we should not make the designation of human reserve antimicrobials depend on veterinary use of such antimicrobials. We consider that the use of human reserve antimicrobials to treat individual animals, not for metaphylaxis, could be acceptable in exceptional cases. But that is something that needs to be laid down in the basic act and should not influence the adoption of the criteria. I'm curious to hear your views on this.
Thank you very much, Sarah.
I give back the word to you, Jean-Yves.
Thank you very much, Sarah. I think this is a good way to start the discussion. So what critically important antimicrobials should be reserved for human use? Are the criteria adopted by the Commission ambitious enough? And I see that Eva has already a hand raised. So I'm turning her directly to her since she's representing the Commission today.
Well, first of all, many thanks for raising this matter. I think that we should understand why this is happening. So first, I want to say that the Commission, what is following is the empowerment given by the co-legislators in the regulation. So in this respect, the draft that the Commission has presented is based on science, because the criteria that we have now in the Delegated Act are based on the advice given by the European Medicines Agency, which was working in close cooperation with EFSA, with ECDC, and with medical doctors. So the starting point is that we may not ignore science. Secondly, the regulation established very well that we should follow the principle that is being followed in the Union, which is the One Health approach. So what we cannot do is just to ignore also other aspects which are linked to animal health and welfare, because in return, it may have an impact on public health. So we need also to preserve public health by preserving the health of animals. And this is very important, as mentioned by other speakers. I mean, animals are there, and what we are doing is to find a balanced approach. So when going to the list of critical antimicrobials, which is established by the WHO, this is fine. The Commission is following two of the criteria which were used by the WHO in order to set their list, and has also added another one, which is in relation to unmet medical needs in the Union. So this is something that we have included. But when all reading in the right context the list of critical antimicrobials for human health, the WHO in its guidelines also established how this is to be used. And in this respect, it is very clearly mentioned that the list of antimicrobials, which is established by the World Organization for Animal Health, has also to be taken into consideration. And there are other considerations that have to be taken when you are taking risk management measures. So the first step is to have criteria which are in line with a scientific basis, which take into account the One Health approach, which is essential. The use of antimicrobials and the ones in the list is going to be defined, taking into account the very few exceptions where their use in animals will be essential. This is why we have established sub-criterion. And I think that this is a very important step forward. Then once we manage to have the delegated act, then the empowerment to the Commission is to draft a list of antimicrobials through comitology. And to this end, again, we will need to have scientific evidence, and this will be the basis, and this will be done by the European agency. So many thanks for giving me the opportunity to try to clarify this aspect.
Thank you very much, Eva. And I'm now turning to the other panelists to see whether they would like to come in here. I would just ask them to be really short in the comments because we have 10 minutes left and we received a lot of questions. So I would love to take some questions also from the floor. I think that maybe Peter wanted to come in here.
Yes, I very strongly want to see a reduction in the use of antimicrobials in the livestock sector. So much of the use of antimicrobials is unnecessary because it's as a result of very intensive farming methods. But we must also get the balance right. Sometimes when an animal really is ill, not because of a bad farming method, but because it has become ill, not just farm animals, but also companion animals, certain use of antimicrobials is necessary. So I wouldn't want to see an absolute embargo on all critically important antimicrobials. One way the Commission could go part of the way to dealing with these objections, if you look at criteria C, the one that's summed up as, that it's non-essential for animal health, the particular antimicrobial, if they added to it wording to say that an antimicrobial is non-essential for animal health if the disease is a result of intensive or otherwise poor husbandry and farming methods. Thank you.
Thank you very much, Peter. I'm now turning to questions that participants put in the chat. And we have here one question from Colleen from the Alliance to Save Antibiotics that we'd like to ask to Jeroen. If that's okay, Colleen is saying, given the evidence that early weaning of piglets results in major increases in diarrhea and in antibiotic use in piglets, should the EU plan to legislate to ensure later weaning? I think it's from a question that could be interesting to pose to the veterinary sector. Jeroen, the floor is yours.
Yeah, well, I fully agree that, well, I would first say that the minimum level of weaning age is 21 days. And we see in many countries that actually that is not adhered to. They even go lower. On average, they have 21 days, but a lot of animals are weaned at 19 or 20 days of age. So just applying the current legislation would already be a step forward. But then again, I also agree on the idea that 21 days is too young. And there is increasingly more science saying that 24, 25 days is probably critical minimal age. So I would certainly welcome this type of legislation or regulation on that. It's also a matter of just showing to the farmers that it's not really helping them. So we really, and once you take away this antimicrobials to cover up management problems or to disguise the health issues due to this early weaning, it will become very obvious. It will become very evident to the farmers that it's a dangerous way of producing animals and it's not a sustainable way. So this new legislation will has as an effect, I'm quite convinced that it will has as an effect that the average weaning age will just simply go up because it's not sustainable without antibiotics.
Thank you for your very clear and complete answer, Jeroen. We also have a comment from Roger Harrison. Roger is saying, why isn't more funding and engagement be taken with regard to citizen action? And maybe I can ask this question to Sirpa, since she is from the European Parliament, who represents the EU citizens. And Roger is saying much greater clarity and education is needed for the public to understand what goes into making the meat, poultry, fish, and what impact it is having on their own human health. So what do you think about funding issues and engagement issues, Sirpa? And I think you need to unmute yourself.
Yes, I was trying to unmute myself, but my pad wouldn't agree me to speak. Anyway, well, I think that if it would be possible, it would be fantastic that the Commission would find some resources to fund NGOs to campaign and inform about the new AMR actions and the reasons for that. And indeed, the Commission sometimes has been very effective in campaigning the information. One of the best successes is, for example, the travelers' rights. Everybody we've seen in the airports telling that the EU is ensuring you this and this kind of a travelers' rights. So I hope that it would be possible for the Commission to launch in all the major shops and places, so shopping centers where people get together, to the right for healthy food and the AMR and the linkage to the animal husbandry and what is the new requirements. Because indeed, unfortunately, I think that in most of the cases in our member states, people do not, because we have so many things to worry about. We are not aware where do our meatballs or tomato sauces, pasta sauces, that matter, come about, and that of course links to imported, not so sustainable food or non-traceable food, and there are other factors, of course, than the AMR that we should be informing even better the consumers. But definitely here, both the environment, the health NGOs, that is very broad community, and then of course the animal welfare community should be financed and being able to campaign and launch the information that you should ask what you eat, and you should be aware of that, and you should not only make your personal choices, but electing, I think Sarah would agree with me, electing the right people in your local parliaments and governments and on European Parliament is the most effective way to combat this issue. Sorry, and a couple of others. Thank you.
Thank you very much, Sirpa. I'm now turning to Imke, because you're a medical doctor, you're presenting the healthcare sector, and the healthcare professionals are trusted members of our community. So what role can the healthcare sector and healthcare professionals, in more particular way, play in driving the transition to a sustainable model of food production that ensures responsible antimicrobial use? Imke, the floor is yours.
I think there are maybe 5 points. One of our aims is to inform the general population via talks on the issue or our internet platform or interviews at the press. And also we are working together with several environmental organizations in Germany, encouraging scientists and medical experts, for instance, for microbiology or epidemiology, to express what they consider a political statement is apparently difficult. The reason could be the fear of putting oneself in a compromising position towards their employers or clients in industry, I think. Since years, we have been considering to take legal action. Recently, we commissioned a legal analysis by Dr. Davina Brun, who is here with us and can later explain perhaps this legal opinion to us. Fourth, we are in contact with political parties and members of parliament. Recently, we were invited by the German Social Democrats to comment on the new German Medicines Act for veterinary use in the hearing of the Committee for Agriculture and Nutrition of German Parliament. And we are lucky to have the German Medical Association on our side. Every doctor in Germany is a member of this association. They have commented the Medicines Act as follows: the use of antimicrobials, which are reserve antibiotics for humans, should be left for human use exclusively. On the occasion of the objection against the EU Commission's delegated regulation, I think that Germany's Medical Association will hopefully give an according statement.
Thank you very much.
We are searching for allies in society.
So I see there is a need for engagement between healthcare professionals and policymakers on this. I think that time is already running out, so I would like to ask maybe 2 last questions to Eva. I'll try to group them together. There is one comment from Katie Vermeers. She says a reduction of 50% by 2030 on the use of antimicrobials in the veterinary sector is envisaged in the farm to fork strategy. What is the reference year of this reduction? And then there is one comment from Sarah Thompson who says the time to full application of the veterinary medicinal products regulation is close to 6 months away. However, governments and industry are not able to prepare for the ban of antimicrobials as the implementing acts on the list and the dedicated act on import is not available. Will there be a transition period available for compliance? The floor is yours, Eva.
Well, many thanks for this question. In relation to the first one, just to clarify that we are not referring to the use, but to the sales, and the year of reference is 2018. As for the second question, as correctly pointed out, the date of application of the legislation is January 2022. We are now still working on the delegated act setting the import conditions, but as I explained, all the legal acts are interlinked. So before we can proceed with this one, we will need to finalize the delegated act on the criteria to set the list and then to continue. So at this point in time, I cannot give you a precise date, but the Commission is doing its best in order to find out a pragmatic solution. So thanks again for your questions.
Thank you very much. And to finalize the panel discussion, I saw that Jeroen had his hand raised. So I will give him the opportunity to give some final words.
Yes, thank you. Well, I just wanted to react to the intervention of Imke, and I just wanted to suggest to add one additional action they could take, and that is to be very responsible with the use of antibiotics in human medicine, because the resistance goes in both directions. It goes from animals to humans, and it's a very obvious thing that we have to do something about that. So my comment is not meant to take away our responsibility, not at all, but it also goes in the other direction. It goes from humans to animals as well. So as long as we continue to do the blame game, I think we do not achieve what we want to do. If we take on the responsibility on both sides equal, then we probably will go further. And I can assure you that there are scientists that are not afraid to make statements in public. So not all are the same. Thank you.
Thank you very much, Jeroen. I think you're right to stress the need to adopt a One Health approach here. So actions need to be taken in the animal sector, but also in the human sector and in the environmental sector. So thank you very much for these comments. And I'm afraid that time is already out. It's time to conclude this exciting discussion. So thank you very much to our great speakers for this excellent first session. We'll now have a short break of 8 minutes. I would kindly ask our speakers to turn off these cameras and to mute themselves. Please stay connected. The second session will start, as I said, in 8 minutes at 4:20 Brussels time.
Yes, welcome back to the annual meeting of the MEP Interest Group on AMR. I hope you are still there, and we had an insightful and I think a very exciting discussion before the break, and are now approaching the second thematic area of today's event. While in the first half of the event, our distinguished speakers focused on internal developments within the EU, this second session will take a broader approach and address potential avenues for the EU to shape the global agenda on AMR. The discussion we foresee now will discuss the lack of a level playing field for food imports. Third country operators will have to comply with the ban on the use of antimicrobials for growth promotion and the ban on the use in animals of antibiotics designated as reserve antibiotics for human medicine, as laid down in the veterinary medicine regulation. But these third country operators will not be subject to other provisions of the regulations, such as the ban on the prophylactics use of antimicrobials for groups of animals and restriction on metaphylactic use. This poses a threat to European consumers and exposes EU food producers to unfair competition. I will now give the floor to Zoltan Masai from the European Public Health Alliance, who will moderate the second session. Zoltan, the floor is yours.
Thank you very much, Sarah, for giving me the floor, and good afternoon, everyone. I'm really glad that I have the opportunity to moderate these afternoon sessions from the European Public Health Alliance, which is co-hosting the MEP Interest Group Secretariat together with Healthcare Without Harm Europe, with the support of the AMR Stakeholder Network. Maybe it is worth to mention just in one sentence that the AMR Stakeholder Network is hosted under the auspices of the European Commission's EU Health Policy Platform, and it brings together more than 60 leading organizations and individuals committed tackling AMR at national, regional, and European level, covering all dimensions of the One Health approach. So before opening now the floor and introducing our speakers, may I just kindly remind participants of a few pragmatic aspects. Like during the first panel, we have dedicated 1 hour for the discussions with our 5 invited speakers, who will share with us some sparking ideas, which will be followed by questions and answer sessions. As previously, we would like to have this session as interactive as possible. So please keep up the same activity as in the panel 1. And you can use the question and answer function to comment or ask questions. And we will get back to them to the second part of the panel session. You also have the opportunity to engage on Twitter with the hashtag of the MEP Interest Group, MEPVSAMR. After closing this panel, we will summarize as much as possible, and time allows, the key outcomes of the discussion of both panel 1 and 2, followed by the closing remarks of MEP Sarvino on behalf of the Interest Group. As time is indeed limited, without further delay, I suggest we turn our attentions directly to our 5 excellent speakers. And now I kindly invite the second panel members to turn on their cameras now, so that everyone could see you very well. So first of all, I would like to thank you all for being here and for your time you dedicate to this discussion. And our first panelist is Stephanie Gislen, who is the Trade and Animal Welfare Program Leader at Eurogroup for Animals. Stephanie, you have been following in the past years the various aspects of EU free trade and investment agreements, and maybe you could give your initial views on how you see the role of international trade policy on sustainable food systems from an animal welfare perspective. Stephanie, you can unmute yourself and the floor is yours.
Thanks, Zoltan. It's a real pleasure. Thank you for inviting me. It's really nice to be able to talk on this topic. As you say, I work on trade and animal welfare, but of course it's quite connected, as the use of antibiotics on animal production is quite linked with animal welfare standards usually. So as you say, I work on trade, and basically I've been following negotiation, but also implementation of FTAs. And we are doing that because we do believe that trade is not neutral. It's not a status quo to have a trade agreement that says nothing about those issues. In general, most of our standards, at least for animal welfare, but at the moment still on antibiotic use as well, a lot do not apply to imported goods. And so usually unconditional opening of the market, as usually it's tended to actually foster what we call intensification of animal production, not only in the foreign countries, who become also much more export oriented, but also in the EU. It's a difficult game, of course, when you don't have the same rules within the EU and in external partners. So it has tended to foster more intensification, and that's very detrimental for animals, but it's also very bad for public health, because usually it goes hand in hand with much more antibiotics being used in those animal production. And so for us, how could actually trade policy address this issue? Because it's not neutral. It means that if nothing is done, it's actually quite detrimental, in our opinion at least. But there are ways, and the EU has tried already a few, so it's interesting to see it's getting in that direction. The best way, of course, for us is to have more rules implemented on imports. And as was mentioned in the introduction, that will be the case with the new regulation coming for antibiotics. But of course, we would have also supported that the ban on prophylactic use and group treatment will also apply on imported goods. That is always the best, because it provides an incentive to other producers to improve their standards in order to actually get into the EU market. It's an incentive to win-win for many producers. So this is definitely a path that could have been used. But of course, when you can't do this, there's also the way to try to use the free trade agreements as a platform to promote a more prudent use of antibiotics. And there, the strongest tool, in our opinion, is always market access. So you could also, at the moment, in terms of animal welfare, that's what we are advocating, that trade preferences, be it a tariff rate quota or liberation, is only granted when certain standards implemented in the EU. You can't ask what you don't do, but that certain, in order to be granted those preferences, you have to respect certain standards. And one could imagine that as well for the use of antibiotics. It wouldn't be completely at odds. It would work as well. And the other option, if you look, is of course to look more at cooperation. And there it's interesting to see what the EU, the direction the EU is taking with Farm to Fork and with the trade policy review. And in those documents, it's been clearly indicated that the EU should try to use its trade policy not only to enhance cooperation, which is already good, but also to obtain ambitious commitments from the partner on antimicrobial resistance, also on animal welfare. And the Commission has also put in place a chapter on sustainable food systems, so mostly about cooperation. We welcome really this initiative. It gives a good framework, a good context to issues related to animal welfare and to antimicrobial resistance. But of course, Farm to Fork does not call only for cooperation to take place, more for commitments. And I think that there in those trade agreements, and you can see it, I think, in the EU-Mexico Global Agreement, the modernized version, there can be more commitments from the party to phase out some use of antibiotics in the agreement. And that can be also very positive, because it would apply not only to the export going to the EU, but to the entire production. So it's a very short intro that we were having to give, but those are the different avenues, I would say. For us, trade is not neutral, and there are different tools in trade policy that we could use to promote a more prudent use, to promote more sustainable model of production that require also less antibiotics. Thank you so much.
Thank you very much, Stephanie, for these insightful interventions and your reflections about how neutral trade should be, and making pragmatic ideas. I'm sure that will fuel the discussions and the panel flow later on. So I would like just to take this opportunity to remind participants that if you have a question to Stephanie, you can table them now or anytime using the question and answer function. And yeah, we will address them at the discussion part of it. Likewise, if you tweet about the event, remember using the event hashtag MEPVSAMR. With that note, then it is my pleasure to hand over to our next speaker, MEP Manuela Ripa, member of the MEP Interest Group on AMR, who will just, I assume, build on what we heard on the animal welfare aspects linked to trade and share her insight or highlights about the challenges the EU faces to shape the global agenda. MEP Ripa, you can unmute yourself and the floor is yours now.
Thank you very much, Zoltan. Let me start by saying that I believe that not only since the outbreak of the COVID-19 pandemic, delivering sustainable through trade policy must be the new dogma. This is especially true for animal welfare. Many of our most pressing global issues are stemming from weak animal welfare standards. This includes the climate crisis, the biodiversity loss, antimicrobial resistance, and the spread of zoonoses. And we have the next pandemic right in front of us, as industrial animal farming plays an important part in the spread of zoonoses. These farming methods need to rely on the routine use of antimicrobials, which cause antimicrobial resistance in humans. You discussed this part extensively in the first panel, so I will not elaborate on that. And if we look at our trading partners, they definitely have an overuse problem of antibiotics. China accounts for 23% of the global consumption of antimicrobials in food animals, the US for 13%, Brazil 9%, and India with 3%. Also, we Europeans use too many antibiotics in farming animals, even if not in that extent. Moreover, scientifically speaking, there is a clear link between poor farm welfare practices and AMR. This underlines the importance of addressing these concerns in trade policy. And at the moment, Stephanie already said it, we're discussing at EU level and in the Parliament the renewed EU trade policy after the pandemic. And we are at a historical momentum for substantial and systematic change. The WTO is in its biggest crisis, which is a good basis for new rules echoing urgent needs of climate and animal protection. Until now, the FTAs, so the free trade agreements, tend to weaken animal welfare. Specifically, they encourage the development of intensive animal production without ensuring compliance with domestic maximum residual levels of antibiotics. These agreements have, until today, little to no animal protection, while allowing considerable liberalization of trade and animal products. To cut it short, our trade policy needs also to contribute to make our society more resilient by better addressing animal welfare. And it is indeed possible to make trade agreements more sustainable and to have more animal welfare standards. The FTA negotiations with New Zealand can be a first chance to make TSD chapters enforceable and part of the overarching settlement system. And the EU should not lose this opportunity. And also trade negotiations of the EU with all third countries need to have strong TSD chapters, and especially related to the use of antibiotics and AMR. Under no circumstances should it lead to the stimulation of industrial animal agriculture. We can't afford to sideline animal welfare in FTAs anymore. In all policy areas, the EU needs to act in the spirit of the European Green Deal, also and especially in its trade policy. So first of all, we need to implement a higher animal welfare standards on farms. As one of the largest markets for agricultural products, the EU can play a major role in promoting its AMR-related standards, measures in food production, and standards on animal welfare. But we need also to make sure that efforts made by our farmers are not compromised by the extensive use of antimicrobials of trading partners. We tried last week in the plenary to amend the official control regulation and to impose restrictions on imports from third countries of animals and animal products using antimicrobials not allowed in the EU. This is key, as it won't make much sense to install high standards here, only to import lower standards from third countries. So trade agreements are therefore key in securing animal welfare. Facing the climate and biodiversity target, we need to have FTAs that preserve biodiversity and foster animal welfare and do not weaken them. Furthermore, the EU should only grant trade preferences to products respecting animal welfare standards, equivalent to those applied in the EU. And certainly it can help to install import restrictions and tariff incentives, combined with material penalties in case of violations of EU regulations. And next to the FTAs and trade agreements, we also need to foster dialogue and cooperation with third countries to fight AMR. The EU development policy can play an important role in raising awareness and sharing experiences. To conclude, the issue we are currently facing, the climate crisis, biodiversity loss, the spread of zoonotic diseases, AMR, are all global problems that do not stop at any border. Therefore, we need global solutions to these global problems. And I believe that the EU should be the front runner for this. Thank you very much.
Thank you very much, MEP Ripa, for these clear points and making the links to other crises, global problems, and reminding us that how poor animal health is linked to those other structural challenges. I think you made a good case how trade policy is linked to the other EU developments. You also mentioned the WTO reform, and I'm sure these elements will be picked up eventually by other speakers or by the audience. So with that, now it is my turn to move to our next speaker, Birthe Steenberg, who is with us as the Secretary General of the Association of Poultry Processors and Poultry Trade in the European Union, AVEC shortly. Birthe, your sector faces the many challenges we are just discussing now. And as you are also active in international trade, you also have a first-hand experience on the global market. So what is the EU's poultry sector's assessment of the recent development affecting antibiotic use, and how do you see the global landscape affecting your members? You can unmute yourselves, and the floor is yours now.
Thank you so much. I think I should be unmuted, and thanks a lot for the possibility to give my opinion in this very important conference. Sorry. As you said, I represent the poultry meat sector in the EU, and we are the sector facing the most imports when it comes to meat. In the EU, in the average in the last 5 years, we have imported 20,000 tons of pork, 300,000 tons of beef, and 900,000 tons of poultry meat. And we actually import so much poultry breast meat that 25% of the poultry breast meat we eat here in Europe comes from third countries. And those third countries are Brazil, Thailand, and Ukraine mainly. What do we think about the antimicrobial use in those countries? Well, to base things on scientific facts, I went back and found one of the reports that Grange, the European veterinary audit unit, made in Brazil in 2018 on monitoring of residues. And there they found many interesting, in brackets, things. Two of them very important to me as a veterinarian. One was farmers in Brazil do not need a prescription from a veterinarian to give antibiotics to their animals. And two, they do not need to record their use of antibiotics. And that is very different from what we do here in the EU. And I would like also to elaborate a little bit of what Professor Jeroen Wolf said in the last session, that it is actually possible to reduce the use of antibiotics, because in the European poultry meat sector, we really have fantastic examples of that. And it all comes down to change of culture. And that demands that many stakeholders go together. We need the farmers, we need the processors, we need the veterinarians, we need the authorities, but also the academia in a country. And when they go together, really fantastic results can be achieved. And actually, I can tell you that in Italy, they have managed to reduce the use of antibiotics for poultry, for broilers, with 91% from 2011 to 2020. In the Netherlands, it's 75%. And in France, it's 61%. And that's only examples. Other countries have done a lot as well. I'm not saying that we are perfect at all. I'm saying that there's room for improvement still, definitely. But I would like to see similar reductions from the human side. I would like to see those examples, please. That would be very, very interesting. Another thing is that it's very, very hard for the European farmers who have done a really great deal to bring down the use of antibiotics, to enhance the animal welfare, to give the best food safety you can get in the world, and then see that we are importing a lot from third countries. And just as an example, the Mercosur agreement, in the very last week of the negotiations, the quota for poultry to Brazil was doubled from 90,000 tons to 180,000 tons, meaning that when the Mercosur agreement goes totally through, we will import over 1,000 tons of poultry meat, and we import 900,000 tons now. So the Commission, on one hand, comes out with the farm to fork strategy and the Green Deal, and that's, I mean, we need that. I also want a healthy planet for my children, definitely. But then they also have to look at the trade agreements, and we need to be more tough, to be honest. And one thing that haven't been mentioned yet, how are we going to control it if we demand more animal welfare and more reduction of the use of antibiotics with our trade partners? How are we going to control it? Because in many of the countries we negotiate with, they are still more focused on animal welfare than on, on human welfare than on animal welfare for many good reasons. So how do we control it? That was just a question.
Thanks, Birta, for that questions and for the whole interventions, highlighting your sector's view on this and particularly mentioning pragmatic examples on that. I think that brought the issue even more tangible for all of us. So with that, we are now a bit closer to the discussion part of this event. So with that, I would like to again encourage participants to seize this opportunity to put forward questions to Birta or previous speakers using the question and answer function. That brings us to our next speaker, who is Keith Sumption, Chief Veterinary Officer of Animal Production and the Health Division at the Food and Agriculture Organizations, FAO. So after listening to the various aspects of EU trade policy, now I'm wondering, how do you see those points from the prism of the upcoming UN Food System Summit? And what potential do you think the global agreement on the use and access to antimicrobials can bring to this? So we are really keen on your perspective. Keith, you can unmute yourself and the floor is yours.
Thank you very much, and I welcome the opportunity to be here. So firstly, just in terms of my position, beyond animal production and health, I'm also covering across the organization the coordination on AMR. So we do not represent one sector, but actually food and agriculture and its use of antimicrobials in that sense. So first, some reflections on a few things that have been said. You know, is the world an equal playing field for disease risk, for which the challenge is met in some situations by the use of antimicrobials? Well, it's not an equal use. Europe has attained very, very high levels of health status, which enables its production systems to be able to have some relief from the scale of challenge which happens outside its borders. So that doesn't mean that the situation justifies the use of antimicrobials, but it's a different setting to produce. Now, the idea of keeping animals in a more safe and contained way, even in countries with very challenging health status, is often met by biosecurity, and that biosecurity costs frequently a lot in terms of behavior change, infrastructure, and that investment may go with what is called intensification. So it can be possible to both reduce the risk of disease and to some extent then intensification is part of how that production system covers the costs. Now, there's a balance to be struck here between what's been said, absolutely, in terms of but I think we need to reflect on that. There are countries in the world where you cannot keep animals alive without routine use, not of antibiotics, really, but of antiparasitics, and that is that's the norm for keeping animals in East Africa, for example, that they need to have ticks controlled. Now, many of those ticks have become resistant, and that's partly for the same phenomenon as antimicrobial resistance generally. So we do have a very different health situation in which countries are faced. But having said that, there are, for many production systems, biosecurity, good production practices, good welfare, which could do, in a similar way to the speakers have said, create a level of change. Now, to what extent will the Food System Summit help us in this respect? Well, I mean, there's a lot of interesting ideas coming up for discussion at the Food System Summit. Perhaps without saying any support for any particular one, then it's probably quite clear that increasing labeling will, being with this sort of context, will potentially mean that the buyer has more power in the relationship in terms of the demand for products which are produced or have less use of antimicrobials in that production, in that food system, in that food chain. So I think we can see that many of the desired behavior changes that we would like will only be driven by the buyer in the end, and the buyer needs to have more power in that relationship. And that may be one way in which the impact of the buyer can result in behavior change, small scale and large scale, in the countries which are producing foods which are and animal products which are imported. So at the moment, very much a voluntary system internationally, moving that towards one in which the importer and the buyer has more power is likely, and I think that will be a likely way of creating positive impacts. Thank you.
Thank you very much, Kate, for that, and also putting it in the context. Indeed, that's quite a complex issue, and we are glad that you shared your assessment of it. And as you clearly demonstrated, there are many opportunities there, and yeah, that issue should be definitely considered at the global level, as ultimately the EU and everyone is acting there as well. With that, last but not least, we have also our next panel member with us, Koen van Dijk, who is the head of unit for bilateral international relations at the European Commission. And Koen, as the European Commission has many roles here. Yeah. Yes, we understood and we heard that the Farm to Fork strategy was mentioned several times. The Commission also coordinates the action on AMR. In addition, the international trade was quite heavily mentioned in that panel, where the EU has exclusive EU competence, which is quite a thing compared to the competences on healthcare, for example. And also the Commission mandated to implement the health in all policies approach. So putting this all together, what is your take? How can all elements contribute to implement responsible antimicrobial use into free trade and investment agreements and other EU policies? So now the floor is yours, so you can unmute yourselves and please go ahead.
Thank you, Zoltan, and happy to be here and seeing familiar faces in the panel. So it's nice to be here and to discuss this issue. And one of the, perhaps also, of course, I will have some repetition, because of course this is when you come last in the panel. There is of course some repetition, but one thing I would like to start is that at the end, what we want to do is to fight antimicrobial resistance. I think this is the basic element, and it was already mentioned by one of the previous speakers that antimicrobial resistance is a global issue. And by just referring to a global issue, it means that there is not one solution. So that's why when we discussed, for example, on the trade agreements solely will not solve the issue. So it means that cooperation will not solve the issue. Further discussions or implementing certain conditions will not solve the issue. So it means that we have to look at it in a broad way. And if we look then to the different, let's say, activities, and of course, AMR and animal welfare, because it was also mentioned, animal welfare in the discussion is of course a high priority for the Commission, and a lot of work is ongoing. But I just want to flag a few things which is important. First of all, the issues was raised relating to imports. Of course, we have very high standards. Birte was referring to it. We have very high standards which are well recognized in the world. And that's why also we are also a very large exporter, not only importing, but also a very large exporter. But one of the conditions to be exporting to the EU or importing to the EU is that you have to have an approved residue monitoring program. So when we're speaking about the use of antibiotics, the use of, there is a specific provision, a basic provision for any country which wants to export to the EU to have an approved residue monitoring program. So it means that every year the country has to submit a residue monitoring program. They have to take samples, they have to test, and they have to submit these samples to the EU. And these programs are evaluated every year. And if we see that the program is not sufficient, then the program is not approved. And by definition, export is not anymore possible. So it's often linked to public health, animal health, but we should not forget, let's say, the issue of approved residue monitoring program, which is key for any exports to the EU. Second is the issue of putting rules on imports. And I think it's very important, and the discussion, and Eva was there in the discussion before, is of course that any rules we have, we adhere to the rules, we have international standards. So it's very important that we use and look at the possibilities which gives this WTO in the framework of WTO, that the rules that we implement are WTO compliant. This will not say that we cannot do, but we have to see all the elements in the WTO which could allow us to move forward in certain conditions that we will impose on trade. Now, the third point that I would like to make is specifically, and this was referred already on the farm to fork, and specifically on the sustainable food systems chapter. And indeed, this is an issue, and it was also mentioned in the farm to fork strategy, but also in the trade policy. And we are now discussing chapters, as was committed to, in all our new trade agreements or trade agreements in negotiation. So this means we will have discussion on a sustainable food system chapter, including AMR, including animal welfare, but also sustainable food systems with Chile, for example. We have it with Australia. We have it in New Zealand, and soon we will start with Indonesia. So it means that we will, in our, let's say, trade policy, in the discussions on the trade agreements, we will include these elements also into the discussion and try to put these elements into the final agreements and having commitments. Fourth point I would like to make is also the fact that there are international standards. And for example, when specifically referring to the phasing out of the use of antibiotics as growth promoters, there have been recommendations made at OIE level, at WHO, and all the members have committed to adhere. Of course, there is a difference between what you do perhaps in the general session to adhere to rules and what is finally in the, let's say, in the field. But there is also, you cannot, let's say, ignore this element that also there is a strong commitment from all countries in the world to, for at least perhaps some they have stepped out, but at least from a major part of countries, they have committed to phase out the use of antibiotics as growth promoter, which is of course an important element. And then finally, I think it's also, and this was made reference again, is I cannot stress, and I also heard the last part of the previous discussion where Professor De Wolf made reference to it, is the One Health aspect. It's very important that when we tackle AMR, that we always bear in mind the One Health approach. When the Commission back in 2017 made the roadmap, let's say the paper on to fight the communication on the fight against AMR, one of the key elements in this was the One Health approach, because it's one of the, let's say, to really, let's say, have success, we should not focus on one sector, but we should focus on the whole chain, and that's including both human and animals, but of course not forgetting environment. So that's just short to let's say, there are different elements at this stage, and I'm looking forward to the discussion, but we should not put, let's say, all our, let's say, eggs in one basket. We should look at different elements, and at the end, as I said on the start of my intervention, the idea is that we, within 5-10 years, we can really see that antimicrobial resistance has been reducing, because at the end, it's a public health issue that we have to tackle. Thank you.
Thank you very much, Koen. And I think you illustrated very well the complexity of the issue and how the European Commission approaches in your 5 key points, finishing up by highlighting the importance of One Health. I think this is also an element which it's quite important for the MEP Interest Group. So with that, I am glad to note that we are now entering the question and answer parts. We have a few questions already there, so we can address as many as possible, and just feel free to put your questions in the chat function so that we can bring into the discussion. So the first question I would like to bring is addressed to Stephanie. And maybe we can do it in a way that, as there were quite interesting ideas mentioned also by the other speakers. So you can answer the questions, and if you would like to react or comment other speakers were making, I think that will be a good opportunity to do that. So the question comes from Rafael Almeida, saying that how to make fair trade agreement among the countries with different levels of developments. Taking considerations the problem in the South countries, we have just begun to develop our legislation and apply intervention on AMR. I think to apply restrict legislations without to consider these differences among countries, it is just an excuse to apply market barriers to the South countries. What is your take on that, Steph?
We hear this a lot, of course, because one of the key asks is for imports to respect better animal welfare standards. And of course, you always face the risk to hear that it's a bit protectionist. I think it depends what developing countries we're talking about. There is a difference between the BRICS and between, least developed countries and so on. And the systems are very different in the EU. There's a wide set of unilateral preferences for those countries. It's very different. What I believe as well is that Manuela Ripa really made the point very strongly, and I completely agree with her. I don't think it's positive to encourage a model we are trying to run away from. We've encouraged a food system at the moment that is at the heart of huge challenges we're going to face. Even if you don't care about animals, if you don't care about people dying, there are terrible huge economic costs that will be linked to AMR. Huge economic costs have been shown with the COVID-19 pandemic. So already you can start extrapolating the cost of actually not changing our food system, of not transitioning towards a more sustainable food system. So for the developing countries, of course, I think, and the EU does that, and I think that's what we need to continue. It's to cooperate, to bring technical assistance, to offer ways, to help them move. But I do not think it is. I think citizens in the EU have clear views on this. That's what they want. It's not about protectionism. Around 93% of EU citizens in 2016 in a Eurobarometer said that they actually want imported goods to respect same animal welfare standards as in the EU, the ones that are applied in the EU. So actually consumers do want this. I think that if we take the time to explain to the partners why we are doing this, why on the long run it's better for them, in terms of the use of antibiotics, on terms of the impact you have on zoonosis, the impact you also have on climate, the impact you have on a lot of other, let's take feedlots of very intensive productions, usually also have a very strong environmental impact. And while we don't cost those externalities, we just simply believe that it's okay to continue this way and people have the time to transition. And yeah, I'm probably the alarmist NGO, but at this moment, we're really scared at some point. We are getting more and more, the more we're talking about this, the more we are reaching the point where it might be just, impossible to fix it. And I'm still an optimist. That's why I continue. I don't think we're there yet. And yeah, so I believe you can build it first because there are different. The EU does take that into consideration when they do trade agreements. And I think there are a lot of tools that you can offer the partners to make sure that they can transition. And this just has to be a comprehensive approach. It's not only about trade. There are other things than GDP benefits. You need to look at how the future is not only about GDP, and you need to see how we can create a more sustainable transition for everybody, not only in the EU.
Yeah, thanks for that, and also for being optimistic here. Now I would like to turn to MEP Ripa, as you were making quite a strong point on trade, and actually there is a comment I think you can handle, especially that it links, or it is similar to a similar issue raised in the first panel, namely about policies, changing policies versus education or information campaign. So more specifically, it is Edward Böckler stressing that a part of trade, education of the EU population is something which should be considered, and that can lead also to changes. So a part of good trade deals. So what is your take? Is there any plan at the EU to taking messages about the population level to motivate people to support better animal welfare in their consumer behavior in an informed way? So and obviously, as you speak, feel free also to pick up other elements other speakers mentioned. MEP Ripa, the floor is yours.
Yes, thank you very much for this question. First of all, regarding barriers, I just want to underline what Stephanie said, and it's not about barriers here. It's about the public common good, and this is public health. So I think that we should have a broad perspective and not see only to be one-sided. Regarding consumers, I strongly believe in the empowerment of consumers. I think consumers should see clearly what they're buying, and consumers want to be more informed. You mentioned that, Zoltan. I mean, every year in Germany, where my constituency is, we have surveys where 95% of consumers want to know how animals are raised and how they're kept, and they don't want a special form of animal, the industrial animal farming. They're absolutely opposed to it. So I believe if we give the consumer the power to see what they're buying, then they will turn to buy better products that are not so detrimental for animal welfare. So I very much fight in the European Parliament for a label, for an EU mandatory label. That is very important. So we need one label, not thousands of labels, confusing us all. One mandatory label informing also how an animal is kept, what if it was fed with antibiotics. I think this is so important, and I'm sure that people will not buy this meat if they can read, okay, here it was fed with antibiotics. Because people care about their health, but often they are not able to inform themselves or don't have time to inform themselves. So give them a clear label, and I'm sure that we have seen this with the egg production. Once we had the numbers on eggs, I'm not a fan of numbers. I want really clear pictures. I want a picture how animals are kept on the meat so people can see it, and clear language, so no numbers. But once numbers were installed, suddenly there was no cage farming of hens anymore. Zoltan, you invited me also to comment on other things that were said. I mean, Mr. Cohen said, sorry, not Mr. Cohen, Mr. Van Dijk Cohen said that there is a big commitment from all members and all sides, but I don't see this big commitment. I'm missing really political willingness to actually change the system. I mean, if we see free trade agreements that we have, once the agreement is in place, there is a lack of really political willingness and resources to generate concrete progress for animals. We only had in all free trade agreements one case, where this was the Chilean case, where there is maybe Stephanie can tell you more about this, but there is a kind of animal welfare, but all others are really lacking of it. And Birte just explained us very nicely what Mercosur would mean for the poultry farming and how much this meat would increase. And I told you the numbers before, how many antibiotics are used there. So I'm really convinced that we need this policy shift away from trade liberalization and to regulate trade, respecting more animal welfare, because as I already mentioned, it is not only about us, it's really about our whole planet, and our whole planet is affected by our consumer habits. So we really would need to act, and we need to empower the consumer. Zoltan, you're muted, sorry.
I was just thanking MEP Ripa for not only answering the questions, but also making these additional points. And you mentioned also the poultry sector as well. And actually, I think there are also a question there. So maybe Birte, you would like to come in. First, I'm happy to see that there were some interactions about Brazil. You already engage. Also, Karba were asking from you that there are imports from Brazil also checked for resistant bacteria. So maybe you can quickly comment that. And there is another question from Nuno Marcus. I'm just reading it, that antibiotics used for growth promotions were banned in 2006. However, certain ionophores such as monensin and salinomycin are still widely used for managing coccidiosis in poultry. Why an exceptions for ionophores? We have credible alternatives like vaccines and feed additive in the market. I know there is a couple of issues together, but I hope you can address them. Birte, the floor is yours.
No, I'm a woman, so I can handle many things at the same time. So that's not a problem. Let me please start with the commenting on Manuela Ripa's intervention, because we agree on many things, but we certainly disagree on one thing, and that is that you mentioned that a package of meat should be labeled with antibiotics used. Because we have withdrawal periods, which is scientifically based, so it ensures that there is no residues in the meat whatsoever of the antibiotics. And it's very important that animals can be treated with antibiotics if they are ill. We have a sentence saying, use as little as possible, but as much as necessary, because the animal welfare goes down the drain if we are not allowed to use antibiotics when the animals are ill. We have some very bad examples from the US, where it suddenly became a thing with the retail sector that they would have a no antibiotics ever label on the meat. And that resulted in some very bad animal welfare issues in the US. So responsible use of antibiotics, that's the way we should go forward. And we should focus on reducing the antimicrobial resistance. And of course, we will do that by bringing down the use of antibiotics, not only in the veterinary sector, but also in the human sector. Now I said it again. Okay. Then we comes to the empowerment of the consumers. I totally agree. And there we have a huge communication task in front of us. In a Eurobarometer report from 2018, about what do the consumers know about antibiotics used both in the human sector, but also the veterinary sector. 36% of the people asked knew that we are not using growth promoters in the EU. 36%, and we stopped with it in 2006. And in my home country, Denmark, we stopped with using the growth promoters in 1996. And in Denmark, only 32% of the people asked knew about it. This is not good. I mean, we really need to inform people much more. So, and there we have, I think, a common task. Us from the sectors, you from the parliament, the NGOs, the commission, everybody, we should get that information out there so people can make their choices on a much more informed basis. Then to the ionophores. Ionophores are used for treatment of coccidia. Coccidia is not bacteria. Coccidia is a parasite. And the parasite goes down into the intestine of the animal. It can be in poultry, it can also be in other animal species, and it is everywhere. So if you have poultry, it's totally, it's almost impossible not to get it. If you have the hens to go outside, it's totally impossible. So, and that little bacteria, it makes some trouble in the intestine. So it gets much easier for bacteria to then get in. So if you are not trying to get coccidia out to prevent coccidia, then you're getting much more bacterial infections, which would demand much more use of antibiotics. Furthermore, the coccidiostats have never seen to transfer any antimicrobial resistance to humans because it's not used in humans at all. So vaccines, yes, let's have a greater look at them, of course, but it is very important for the poultry sector as a whole to be able to prevent coccidia from entering the gut of the poultry. So I hope that answered the questions.
Yeah, thanks for that. And obviously we are following the questions, but if and we are still a bit time, so if you would like to react, you can also raise the hands and maybe we try. I think MEP Ripa just did it. Maybe if you can do it quickly, then we can and then we can move on to the next questions. So MEP Ripa, yeah.
Yeah, just a very quick comment. I was not talking about labeling if an animal is ill and it gets treated. I'm talking about the routine use of antibiotics that you especially have in industrial animal farming. That is what it was about. So just to clarify here.
Thanks for that. Yeah, just moving on, actually there are quite many aspects raised. What the EU should do and how can we address that? And here is the questions. I think maybe Keith would be the best place to answer. We touched upon this already in the opening remarks, and obviously feel free to comment specific elements we are just discussing now. So the question reads out that what role can the EU play, in your view, in championing responsible antimicrobial use at the upcoming UN Food System Summit? Keith?
Thank you very much. Well, I think the answer there is the Food System Summit is everyone's summit, and the EU is very much part of it, and the EU consumers, civil society, private sector, all very much part of that summit. So I don't think I have a stronger view than anyone else on this, but you know, having said that, I mean, let's consider that there are sort of several solutions that are coming together that need to be understood at the same time. So the One Health approach has been mentioned. Now, what does this mean in reality? It means that we do need to come together over solutions affecting multiple sectors at the same time and at country level too. So the Food System Summit and reflecting on the nature and the control of different parts of the food production chain, the way that we buy and the way that we produce. Well, we also need that at country level, and those food systems assessments are very important to that. Now, I think the EU has been doing really a very good job with FAO and others looking at national food systems in a whole range of countries. Perhaps what we need coming out of this summit is actually going to be how we create incentives in countries for them to invest, for them to undertake the changes. Some of that will be related to trade, but some of them will also be just in the interest of the country in terms of diversifying what it's doing and also applying more sustainability at production to consumption within that area. And I think in relation to this, I think one thing that we can do better together is connect these two things: food systems, antimicrobial use, One Health at country level. So our approach has been to suggest that food systems, biosecurity, and health go together. So one of the follow-ups that the EU could really help on would be, let's do that at country level as well. How do we make and produce food, not just animals, but also in terms of crop production, in terms of aquaculture? which is less challenged by disease, needs less antimicrobials, is more welfare friendly, is more sustainable. So that's taking a whole approach, putting it together, assisting countries to look at what they're doing, assisting them to think about their investments. It doesn't mean giving money to invest. It means helping them to make those investment decisions. So I think the Food System Summit's only the start of a journey, but that journey needs to take place pretty much in all the countries around the world. And that part of what the work needs assistance, and we need to link antimicrobial use into that.
Thanks for those points. I think it is relevant also generally for this discussion. Now, I would like to bring two other comments, questions to the discussions, and I can see Stephanie's head. So maybe the way we can proceed, I would like to really have a Q&A's views, so also from the commissions about that, and maybe Stephanie can follow that as well, so that I think time would allow that. So the questions I was mentioning, the one is coming from David Garay, saying, how can the EU's trade policy and agreements be adapted to ensure it implements the EU's evolving farm to fork vision? So I think it is linked to your 5 points as well. And the other questions from Konstantinos Tsilimakis is it responsible to dump the problem on the shoulders of consumers? Shouldn't products with good standards via rules and laws and little AMR risk be put on the market from the start? Is it realistic to expect consumers to solve the demonstrable problem? So with those questions in mind, Quan, feel free to answer, and then maybe, and after Stephanie.
Thanks, Zoltan. As a consumer, we don't have to put it all the blame on ourselves, but I just want to comment what was said before about empowerment of consumers. I think it's one of the issues of the farm to fork, and you all read it. It's one. Again, it needs the whole chain to be, and it's like, normally we speak about the whole chain, but if you look to the chain and all the different actors, when we really want to move forward to the sustainable food system, it's enormous. It's enormous. So it's not only the agriculture, it's not only the producer, it's not only the consumer, but it's a lot of actors which have to play their role. And that's why when we spoke about labeling, I think it's important that the consumers know. But we should also, let's say, look at this labeling also relating to, if we have labeling, that also to sell this, let's say, to our, let's say, trading partners, that when they export and they follow our rules, that they could use a label, which could then be also an advantage for them when they access the EU market. So I'm not expressing myself on voluntary or obligatory, but I think that the issue of labeling, I think we should also, let's say, promote this outside the EU, and also, let's say, when we discuss with our trading partners, to make this also clear that this, from themselves, they can make certain activities. They can, as an industry, can move forward more rapidly than perhaps that is required relating to at national level, but also use this as when they access the EU market to have an additional, let's say, advantage when assessing the EU market. Second point, I think it was mentioned on the discussion, one of the important things is also innovation. We should not forget that when we want to really, let's say, change our food systems, we can of course do things already now, but we have to look, and with a very broad sense of, let's say, an open mind, looking to innovation. And I think everybody has seen the report on new genomic techniques, which of course is an important study. And I hope that everybody has a careful look, and actually we will have tomorrow, we have a session with our trading partners to explain this study, because it gives very clear and very interesting ideas. So it's important that we also, in all this, let's say, this move to sustainable food system, that we keep well in mind, let's say, this aspect of innovation. Now, coming to the specific question relating to, relating to our trade agreements. I always say that negotiating an agreement it takes long time. I don't want to make reference now to Mercosur, but it takes long time. But when the work starts is implementation. And I think that's, of course, an issue that when we start, let's say, really working on the implementation, that needs resources, that needs work, that needs a lot of activities. So I think it's very important that when we speak about, let's say, not having it only in the agreement, but also have this implementation. And of course, from the EU side, this is, of course, an important element of our work to look at these, let's say, the different, let's say, agreed conditions within the agreement, and then to put them into practice. But of course, it also takes time. So I think it's important to, let's say, yes, it might take time, but it's something to be carefully assessed and worked on to move forward. That's all. Thank you.
Thanks, Juan, for that. That was actually quite clear. Just looking at our time is running fast, so just I would like to kindly ask Stephanie to be short in your comments. Thank you.
I will try my best. I had a few points on what Keith said. For instance, what the EU could do when we're talking about interaction at the multilateral level. It's true, but the EU, I think, can also lead by example. There are some decisions that the EU should take, and I think they're going to take it soon. I'm hopeful. For instance, we were a lot talking, and you talked about this in the previous session, about the link between antimicrobial resistance and intensive system. I know my colleague Peter has been talking about this, and I think that moving away from cages in the EU will be an enormous progress, and we should not be shy, and we should also work with our partners and impose that on imported goods. I think it would be WTO compliant. I'm happy to answer any question about this, but yes, I think we should go for that, and we should also lead by example. This is what we are in the EU. In terms of the FTAs, I've explained how I would see this in terms of conditionalities in trade preferences. Could work also, that's what we want for animal welfare, could also work in terms of antimicrobials used in general, but also by making language in cooperation provisions more committal. As Koen said, the work is really important in implementation, and I think the EU now is really trying to take a better direction on this and trying to put more resources into implementation, and that's very welcome. And it also underlined the importance of good language in the agreement, because if you have weak one, it really shows in implementation. You can't do anything. In terms of the labeling, we definitely support a sort of method of production labeling, as was explained. But yes, we don't believe it's panacea. The consumer should not have to do everything for certain aspects. It should actually basically, it should show up from EU level to better levels, helping producers to, showcase that they're doing better as well. And it can help, consumer to give incentives for that. And as Koen, I believe it should be mandatory, and it should be imposed to imported good. Again, I would say it could be WTO compliant, depending on how it's crafted. But I also believe, like Koen, that some partners would like it, because they would be able to actually demonstrate to EU consumers that they actually have, certain producers have higher level standards in terms of animal welfare, and they would be happy to avoid being associated with bad standards as well. So I think it would be a plus. And on gene editing, I would be looking into that, because the impact on animals of certain of those manipulations, especially the test phase, and how it with the muscle. So yes to looking at alternatives and innovations, but always with having in mind the impact it can have on the welfare of sentient beings. It's not crops. So just that point.
Thanks, Stephanie, for that, and I think that was a nice addition to that, and I would like to follow this, but unfortunately, time does not allow us, so we have to stop here with the discussions, and time has come to summarize the discussions before closing the event. But before doing that, I would like to thank you again, our excellent panel members, the speakers, for their commitment, contributions, and that I think you managed to answer quite many questions which we could put forward. And that, having said that, our thanks goes also to our active audience for your attentions, for the questions and the comments which we received. We have them, and that will be very useful to reflect upon after the event. So now, obviously, time is running, but and we are in a difficult situations to summarize in a few sentences two complex discussions. But at least Jean-Yves and myself, we would do our best to do that. So first, I would like to highlight a few elements on the first panel. We heard that the EU is a leader at global level to fight AMR, and the veterinary medicines regulation is a major step forwards. It was also said that we cannot see the matters in isolation, and we have to see the suggested legal acts as a whole, as a package, and there are also mentioned empowerments 8 actually. The delegated act on antibiotics reserved for human use only was mentioned as a good example for that, and that the list will be drafted soon, which will be applicable both in the EU and imports to the EU, fully in line with the One Health approach. The collection of data was highlighted, and the EU legislations can facilitate that, which will be helpful for the fight against AMR. However, concerns were also raised that the EU livestock sector and the EU member states are not prepared for the full implementation. It was pointed out that 87% of antibiotics are eligible to be used in human medicine, so higher ambitions compared to the 50% could be possible. And it was also stressed that basically far-reaching rethink is needed how we farm animals. Other concerns were also raised about that why the progress is so slow, and it was said that there is some resistance in the agriculture sector, and the common agriculture policy financial support will not favorize those farms which fully respect the rules of responsible use of antibiotics. That was one of the concerns. And proper implementation was mentioned as a key, not only words, as the large amount of antibiotics put in the air and the water is problematic. And the EU has also the power to intervene in case of imports, and our free trade agreements could include also that. It was also said that the ambitious EU standards are realistic, as some member states already demonstrated that good practices can be implemented. And we saw that in those countries making progress, that good monitoring systems were in place. A point was also made that we have to keep animals healthy, as if they are healthy, they do not need antibiotics, and farmers need help to make them easier to conform the EU rules. It was said that we cannot say big farms are bad farms. The size of the farm is less relevant rather than the management and the use of appropriate technologies. We heard a German country-specific case study demonstrating that since 2011, when the monitoring was introduced, the drop of 60% consumptions was observed, but this trend was not observed in the poultry sector, where that amount was 10%. And it was said that the new German Medicines Act for veterinary use did not change the monitoring, and no rules were introduced on antibiotics reserved only for human use, where the EU legislations can make a difference. And we were hearing a clear voice from the medical professionals from the country asking for more alignment with the WHO list and increase animal welfare. We had also an interesting discussions a part of the panel, where it was clear that there were concerns raised with regard to the criteria concerning the delegated acts, which definitely needs close attention in the future. And the discussion showed that there is willingness to reduce the use of antibiotics, but the complexity of the issue was also mentioned as an absolute embargo would negatively affect critically important antibiotics. The importance of citizen engagement and funding to facilitate that was stressed. It was mentioned that the Commission can be very efficient about campaigning, informing, for example, about traveler rights. So maybe that can be something repeated in this field. And the role of civil society and NGOs was also highlighted, who can reach out a broad community together with the animal health community to campaign on AMR. It was also mentioned that legal actions are possible, and that work is in progress. So it is a moving target we are discussing. So I try to do justice about the quite complex panel 1 discussions, and I would like to hand over to Jean-Yves to summarize the panel 2 discussion.
Thank you very much, Anton. I fear I have the same difficulties that you had to summarize the great discussions you had during the second session. I think you had a really exciting debate and great speakers. We first heard from Stephanie from Eurogroup for Animals, and Stephanie said that the intensification of animal production is detrimental to animals, but also very bad for public health, as it is associated with increased antimicrobial use. She called for more rules to be applied to goods imported into the EU. And she raised the point that trade is not neutral and that there are different tools that can be used to promote responsible use of antimicrobials. We then heard from Manuela Ripa from the European Parliament, and Manuela said that delivering sustainable trade policies should become the new norm. China, the US, India, and Brazil are driving antimicrobial consumption on the global stage. And the clear link between poor farming practices and AMR demonstrates the need for sustainable trade policies to make our societies more resilient and ensure high animal welfare standards. She finally mentioned that free trade agreements need to protect biodiversity and animal welfare. We then heard an industry perspective from Berth, who is working for AVEC EU Poultry. And Berth said that the poultry sector is the sector facing the most imports from third countries, especially from Brazil, Thailand, and Ukraine. She demanded a culture change, bringing all stakeholders together, and pointed out a good case study from Italy. And she finally also called for further efforts from the human health sector to reduce antimicrobial use along the animal health sector. We then heard from Keith from FAO, who said that Europe had reached a high level of health, but reminded that all regions were not at the same level, and that there are countries in the world where you cannot keep animals alive without antiparasitics. He said that there are many opportunities that could be taken in relation to the upcoming UN Food System Summits, such as labeling that could give more powers to buyers. And finally, we heard from Koen from the European Commission, who reminded participants that AMR is truly a global issue to which there is no single solution. There is a need to look at the issue from a broad way in the framework of a One Health approach. Rules on imports needs to be WTO compliant, but the EU is working to include elements related to AMR in free trade agreements it is currently negotiating. And finally, he highlighted important international standards, such as the phasing out of antimicrobial use for growth promotion. With that, I would like now to give back the floor to MEP Sarah Weaver and invite her to give concluding remarks and close the event. So Sarah, the floor is yours.
Thank you, Jean-Yves, and thank you so much, Zoltan. Wow, this was great, this summary. I was impressed in which short time you could have summarized all the points, or nevertheless, the most points of today's discussion. So because we are very late, I don't want to speak very, again, a few minutes. What I could add is that further reflection is needed on the kind of impact the EU would like to have globally, taking into account its ambition and responsibility. I would also like to thank all our active and engaged audience, and your sharp questions generated a lively discussion and helped increase understanding on the topic. The recording of the meeting will be shared shortly with all of you by our secretary. The debate made it clear to me that we need more action if we want to establish such an enabling policy environment, which makes AMR a thing of the past and ensures a truly sustainable food production system that improves and instead of eroding public health. So the MEP Interest Group on AMR has an exciting agenda for the rest of the year. Please follow the MEP versus AMR hashtag on Twitter to make sure you do not miss important developments. On behalf of the MEP Interest Group on AMR, I thank you once again, and I wish you all a very nice afternoon, and I hope we will see us soon, because there is a lot to do for the AMR. So thank you so much and have a nice evening, and thank you that all the audience and the speakers, you were great. I learned a lot.